Lots of people get Botox to help with their frown lines or to fix their crow's feet, but there is so much more that you can achieve cosmetically with Botox. So today in this video, I'm talking about all of the different cosmetic interventions you can do with it. Hey, I'm Dr. Sam Ellis. I am a board-certified medical and cosmetic dermatologist in Northern California. I'm here to help you understand your skin and find products that work for you. And more recently, I've been getting a lot more inquiries about cosmetic procedures, so I thought I'd start to do a little bit more of that, break those down for you, help you understand that vast world that can be intimidating and sometimes overwhelming. So if that sounds good to you, give this video a thumbs up and don't forget to subscribe to the channel. I was inspired to do this video because on my Instagram stories, I will often take people through my day in clinic and I'll offhandedly mention, oh, I'm doing Botox for X, Y, or Z. And I'll get a ton of direct messages being like, wait, I did not know you could do Botox for that. And I feel like all of the things Botox can do aren't always discussed. And a lot of people come in to get Botox and they're like, I want it here, I want it here, I want it here. And they're maybe not as open to hearing about all the other things you can do with Botox. And that's very understandable. It can be overwhelming. Of course, there's an expense associated with it. But I feel like if you want to know all the things you can do cosmetically with Botox, you have come to the right place. So a couple of quick disclaimers. I don't know if disclaimers is the right word before we jump in. One, I'm not filming this video to make anyone feel bad about themselves, to make you feel self-conscious about something, to tell you that you need to get Botox in any way. This is a super personal choice. I would never want anyone to watch one of my videos and then feel pressure to do an aesthetic intervention. So that's number one. That's a very, very personal decision. And I'm just explaining what is out there and available, not telling you that you have to do it. Number two, when I am saying Botox throughout this video, I am using that really as a catch-all term for any of the botulinum toxin A's that are used cosmetically. So there are other brands besides Botox. You may have heard of them: Dysport, Xeomin, Jeuveau, Daxxify. I'm going to be saying Botox, but you mentally can be replacing that with any other botulinum toxin A brand that you want. For a little bit of a Botox primer, Botox is an injectable that when injected into specific muscles causes them to be paralyzed, and you can paralyze them to varying degrees depending on the dose of Botox used. Cosmetically, this is often done in muscles of the face to reduce the intensity of muscle contraction because it is repeated muscle contractions that lead to the skin creasing over and over again, which in turn leads to fine lines and subsequent etched-in permanent wrinkles. But Botox isn't just used cosmetically to prevent the formation of fine lines and wrinkles, and I'll be talking a little bit more about that in this video. I also have a couple of other Botox videos on this platform that answer a lot of Botox frequently asked questions and walk you through what a Botox procedure actually looks like. So if that interests you, I will link those in the description box. But without further ado, let's just get into all the things Botox can cosmetically do for you. It is the thing I do the most of in my clinic. I mean, many patients a day, all ages and stages of life, all different types of cosmetic concerns can be addressed with Botox. Now, not everything can be addressed with Botox, and that's also really important to note, but it is a very versatile product and you can use it in a lot of ways if you are experienced. So I'm excited to talk a little bit more about that with you. I think the easiest way for me to do this is actually just to work my way down the face and neck. I haven't gotten Botox in about 4 months, so most of it, if not all of it, is completely worn off. And I actually wanted to wait for my Botox to mostly wear off before I did this video so I can demo a few things for you. So location number one, most people are familiar with, it's your frown lines. This area on your face is called the glabella, and it causes you to scowl, frown, whatever word you want to use for that. And there are two main muscles that contribute to this, something called the procerus, which pulls the medial part of your brows down, and then something called the corrugators that pull your brows in towards each other. So when that complex, that glabellar complex is activated, the brows go down and in. So when you put Botox there to relax it, the brows go up and out. So this really helps to soften the 11 lines that people get. Sometimes they actually just get a 1, but most people get 2 lines when they scowl there. So if you do Botox regularly there, you can either reduce or completely eliminate the appearance of etched in lines in that area. The other thing injecting in that area can help with is a brow lift. So people are kind of familiar with the term Botox brow lift. And really what you're doing with a Botox brow lift is you are relaxing any of the downward pulling muscles around the brows. So when you put Botox in something, remember, it doesn't activate the muscle, it deactivates the muscle. So if you are deactivating the downward pulling muscles around the eyebrows, you can get some degree of lift. And how much lift you get really depends on all of the muscles that naturally pull the brow up. If those are really strong and you release the downward pulling muscles, you're gonna get a big lift. If your upward pulling muscles aren't very strong, then you might get no lift or just a mini lift. There's a muscle called orbicularis oculi that goes around your eye, and it can pull, can you see that? Pull the tail of your brow in when it's activated. So if you just deactivate this little portion, these little muscle fibers here, you can get the tail of the brow to lift. And then when you deactivate the ones between the brow, you can get the medial or the center part of the brow to lift. So you can kind of alter the brow shape a little bit with Botox in these locations. Another common area that people will get Botox is in the forehead to help with the horizontal forehead lines. You always have to be a little bit careful with this, because if you are injecting the forehead muscle, which naturally pulls the brows upward, and you lose that ability, some people will have a heavy brow, and that either feels not great or doesn't look very good. So you always have to be careful when you're injecting someone's frontalis muscle or their forehead muscle, because you might make their forehead look super smooth, but if you depress their brows, they're not going to be happy with their overall appearance. And something I always try to stress to my patients is no matter what cosmetic intervention we are doing for you, we want to step back at the end of the day and for you to look better globally. It's not about chasing one line or one little thing up here. It's more about what is the overall effect on your complete facial appearance when we do whatever intervention we do. So actually, for a lot of my older patients who have a heavier eyebrow naturally, even though they have a lot of horizontal forehead lines, I don't inject their forehead because it's much more important aesthetically that they have a good brow position and also that they can see, right? Like if you completely depress their eyebrows, they might even have problems with their vision. So again, Botox is an amazing thing. You can do a lot with it, but it has functional consequences if it's not done properly or if you have side effects. So it's really important that you are going to an experienced injector who's going to do right by you. I'm not saying that even the most perfect injector can't have a bad day or have an undesirable outcome, but those undesirable outcomes will be a lot less with an experienced and good injector, and they will know how to manage any complication if it does arise. Moving down the face a little bit, another area that is commonly addressed with Botox is the crow's feet. And this is an area that has to be done so perfectly. Some people are very bothered by their crow's feet and they would want nothing more than to get rid of all of them. But crow's feet are really what give you a genuine looking smile. And so my goal when I'm injecting my own Botox or for others is really not to eliminate all crow's feet, but to lessen them significantly in a way that maybe helps them not be etched in so deeply over time. But I don't want to take away someone's personality or ability to emote joy by just flattening their entire crow's foot area. And these injections around the eye can actually be taken up quite close to the eyelid margin. Lots of people are bothered by not the lines around the crow's feet, but actually the lines under the eye. And some of that is due to the muscle contraction around the eye, so you can get that with Botox. But a lot of people's under eye lines are due to their cheek elevating or going up when they smile. And that's not something that you can correct with Botox without paralyzing their cheek. And I think a lot of people would rather have the lines under their eye than have you paralyze their cheek. And that's a really good example of Botox not being able to correct every single line on your face. The under eyes are the thinnest skin on the body. They show signs of aging the soonest, and they bother so many people, myself included. And when you have those fine lines under the eyes, Botox is not always the answer. You might need something like laser resurfacing, surgery, chemical peels. There's other things we can do to improve the integrity of the skin under there, but we may never be able to get rid of every single line, and certainly not with just Botox. I'll just finish off the topic of Botox around the eyes with one other intervention that can be done, and that is to address something called the jelly roll, which is a little bulging under the eye that happens only in some people when they squint or when they smile. Aesthetically, I think it's quite cute and youthful, but some people are very bothered by it. So you can actually inject Botox into that bulging muscle to relax and shrink the muscle and make the under eye appear more smooth. Okay, that is Botox for the upper third of the face. Now we'll move on to the middle third of the face. Of course, if you have any questions about anything I've talked about so far, please put it in the comments. I definitely try to get back to you guys and help you have the most informed experience on this channel. So the next lines I'm going to talk about are the bunny lines. So if you scrunch up your nose like this, depending on your unique facial anatomy, you may notice some scrunching of the tissue around the upper part of the nose and even across the nasal bridge. Those are your bunny lines. This is actually one of those facial features that I think makes people's smile look quite genuine, but where it can look a little bit odd is when someone has had Botox in other parts of their face, for example, their scowl, their forehead, their crow's feet, and those areas are not moving or are moving minimally, and then they have this intense activation of their bunny lines. That looks weird. The mind sort of like clocks it as not a natural way for the face to move, and I think it's a pretty dead giveaway that someone has had Botox. And I think this is just a good time in general to point out that Botox looks the best and the most natural when all of the features and all of the muscle movements are in harmony with one another. It's not about having an upper third that's completely frozen and then a lower face that's going at a level 10. If you have Botox strategically and expertly placed, you should just look relaxed and refreshed, not done or weird, or like you can't convey the emotions that you are actually feeling. All right, so those are the bunny lines. Some people, if you relax the upper third of their face, start to recruit intensely from those bunny lines. So it's always something, if you're watching this as an injector, that you want to keep an eye out for. If you notice that when they smile, they are bringing up the bridge of their nose at all, it may be worthwhile to just drop a little Botox in there to keep everything on the same movement page. Let's move on to the nostrils, the lower part of the nose. And again, when I'm talking about these things, it's not something I'm trying to make people self-conscious about. I just think it's very interesting from like an aesthetics point of view of all the things you could do with Botox, not that you need to do any of these. But when we're talking about the alar rim or the nostril area, some people naturally will flare their nostrils more than they want to. For example, I have a really good girlfriend who in every photo is flaring her nostrils and she's like, what the heck? Like, I don't notice that I'm doing that. I can't feel that it's happening, but why are my nostrils so dilated in every picture? And you can actually put Botox into the rim of the nose to cause that flaring to calm down a little bit. So you can calm down the wrinkling at the top of the nose, you can reduce the diameter of the nostrils. The last thing you can really do with Botox on the nose is help with a nasal tip droop. So there is a depressor muscle, so something that pulls the tip of our nose down that sits right under our nose here. And for some people, when they smile, their nasal tip drops. This happens to me, for example. So you can inject a little bit of Botox at the base of the nose to help with nasal tip droop. And it is not a huge correction. It's like 5 degrees of improvement, but anyone who has a droopy nasal tip that's bothered by it will tell you, like, even 5 degrees can make a significant enough difference. Now, of course, if someone is seriously bothered by it, a rhinoplasty, nasal surgery, will do the most. But for like little tiny tweaks, a little bit at the base of the nose can be great. Next, let's talk about Botox around the mouth. There is so much you can do with Botox in this area, but you also have to be incredibly careful because there are a lot of overlapping muscles in the lower face. And if you hit one muscle instead of the muscle that you intend, you can have really undesirable functional consequences, like it can affect how someone talks or eats or chews, or aesthetic outcomes like you can give them an asymmetrical smile. Let's start off with talking about a gummy smile. So a gummy smile happens when someone does a smile to their fullest expression and you can see some of their gums above their teeth. That is called a gummy smile, and you can address this with Botox. There are several muscles that exist in the middle part of the face that pull up on the upper lip. And when someone has a gummy smile, they often have hyperactivation of one or more of those muscles. And so you can inject Botox often around the base of the nose, but it's going to vary based on the individual and their specific gummy smile on where you're going to put it to help relax that upper lip down just a little bit. Now, you don't want to overdo this and make someone unable to elevate their lip at all, because then they will look like this. That's not a cute smile. And so we always have to find that balance, and dosing really matters here because 1 or 2 units of Botox difference can make a big difference in these smaller muscles in the lower face. Another thing we'll often do to improve the appearance of the smile is something called a lip flip. So a lip flip with Botox is used to prevent the upper lip from curling under when you smile. Now again, this doesn't happen to everyone, but some people when they smile, their upper lip does this. It curls inward and they lose the visibility of the pink part of their lip. And a lot of times the classic patient will say, I actually really like the shape of my lips. I just lose the ability to see my upper lip when I smile. And that is typically a good candidate for a lip flip. Botox is placed on the rim of the lip to relax the upper lip so that when you do smile, instead of curling inward, it stays turned outward or flipped outward, which is why it's called a lip flip. So sometimes when someone has a gummy smile where we are seeing gum show above their upper teeth, it's not because they have hyperactive muscles pulling up on their lip, but rather because their upper lip is turning inward. And so rather than treat them for a gummy smile, you would treat them with a lip flip. And that's where seeing an experienced injector really comes in, because what looks like one problem may actually be a different problem, and someone who knows what they're doing will know the best way to correct that. Botox can also be used to help with wrinkles that form around the mouth. These are also called smoker's lines, barcode lines, lip lines. I have an entire YouTube video all about lip lines and how you can fix them. So if that's something that bothers you and you're watching this, definitely check that out for all the details. But one thing you can do is put Botox in the upper lip to relax that muscle, because those lines are caused by repeated pursing of the muscle around your mouth. So if you relax that muscle, you're not going to be able to etch those lines in as severely. So it's better for prevention of future lip lines. So for example, if you start to see those lines being etched in, starting Botox at that point will often prevent them from getting worse. But if you have really deep etched in lip lines, getting Botox there is not going to do much, because those lines have already formed and there's not much prevention to be done at that point. That's another area where you really have to strike the balance of using the right amount, like putting enough Botox in to relax the upper lip, but not so much that you completely paralyze their upper lip and take away their ability to talk, eat, whistle, brush their teeth, all of the things that you need some ability to purse your mouth to do. That was all mostly upper lip. Now let's move down in the mouth to the corners of the mouth, because a lot of people are bothered by downward turning corners of the mouth, and you can sometimes use Botox to help with this. So there's a muscle on either side of your mouth that pulls the corner of your mouth down. It's called the depressor anguli oris, and it's what causes this face. I had to wait till my Botox wore off to be able to show you that, because I almost never have this active, but it's this face. It's different than this face, like this. Sometimes I'll say, show me your frown, and people go, that's very different than this. So when you are injecting the DAOs, or the depressor anguli oris, to help with downward turning corners of the mouth, you need to have your patient make this face. And if they can't make this face, then they're probably not a good candidate for that injection. The reason this helps with the corners of the mouth is because some people will chronically and inadvertently activate this muscle. So sometimes I'm doing a cosmetic consultation with a patient, and the whole time they are actively frowning, and they're not aware that they're doing it. But imagine if you go through life day after day, week after week, year after year, constantly putting pressure on the corners of your mouth in a downward fashion. That's going to cause premature depression of those corners. So by injecting those types of patients to allow the corners of the mouth to be released so they're not constantly being pulled down can help with this position. Now, an injection like that isn't going to completely turn your frown upside down. Remember, Botox relaxes muscles. So by relaxing the downward pulling muscles of the corners of the mouth, you can get them to float upward a little bit, but it's not the same as like pushing up on the corners of the mouth. You cannot do that with Botox. And then the last thing I tend to do with Botox around the mouth is help balance a slightly asymmetrical smile due to muscle asymmetry. And that really involves doing one of the many perioral interventions that I already discussed. So some people will just pull up aggressively on one side of their face. They'll have kind of a sneer naturally. And so you can relax that with a little bit of Botox placed on one side of the mouth. Or for example, in me, one of my lower lips, I can't remember which side now, constantly goes down a little bit more when I talk. And so I like to inject a little bit of Botox to allow my lower lip to float up on that side so that I have a little bit more facial symmetry. Now, I really don't think it should be anyone's goal to be 100% symmetrical. And that is certainly often not achievable with Botox alone, because we can be asymmetrical due to bony asymmetries, muscular asymmetries, fat asymmetries, all sorts of things. So Botox is really only addressing a muscle issue, but some people are really bothered by their asymmetry. I have a few patients who have Bell's palsy, so paralysis of one side of their face. And so we often will use a little bit of Botox to just bring a little bit more balance, and that gives them so much more confidence. Okay, we are working our way down the face. Next up is the chin. So some people have a very active mentalis or chin muscle that causes dimpling of the chin. We lovingly refer to this as golf ball chin or cottage cheese chin or pot orange. It's not a super desirable look for a lot of people, and it's not crazy common, but if you start looking for it in people, you will definitely notice it. And I don't think everyone should be getting Botox in their chin, but there are some people who naturally are always engaging their mentalis muscle, and so they constantly have this dimpling of the chin. And if that is left to its own devices over years and years, that chin will start to look dimpled even when the patient isn't talking or eating or animating. And that can be really bothersome to people. As someone who takes care of a lot of women in their 60s, 70s, 80s, the texture around the mouth and specifically the chin really does become bothersome over time. So you can inject a little bit of Botox in here to soften the chin muscle. Now, it's really important, again, that you are assessing the patient. Some people are always activating this muscle because they have a recessed chin, and they're actually activating this to push their upper lip upwards so they're able to close their mouth. So it's really important that you have an experienced injector do your chin Botox if it's something you think you need, because not everyone who has a dimpled chin is a candidate for it. For example, if you put chin Botox in someone who has a very recessed chin, you might take away their ability to close their mouth, and that's not good. Let's talk about masseter Botox next. So masseters are the big chewing muscle at the back of the jaw here. That guy. And in some people, they are quite bulky and can make the lower face look larger, more squared off. And in some people will just make their face look more round. So what you can do is inject Botox, and usually you need higher amounts of Botox here, high number of units, to deactivate or partially deactivate this big chewing muscle, not to the point where they can't chew, but so that it's not clenching as intensely. And that way, over time, when that muscle is not being exercised to its fullest extent, it will actually atrophy or thin out, which can give the face a more heart-shaped appearance by narrowing the jaw a little bit. Lots of people have heard of masseter injections to help with clenching pain or TMJ pain. So that's another way you can use Botox, but I don't consider that cosmetic. In the case of slimming the lower face, that is really the cosmetic indication here, and it can be really nice in the right patient. From time to time, I'll have a patient come in for a consultation and they'll say, oh my gosh, I heard Botox can be used to slim the face, like, let's do it. And then I'll feel their masseter muscle and they actually don't have a very prominent masseter muscle. So in that case, masseter injections aren't going to work very well, because the reason that their face is more round is either due to facial fat, their bone structure, but not due to a thicker masseter muscle. So this only really works for jawline slimming if you have a big bulky masseter to start with. And I'll just make a quick note here, because I probably won't talk about it during the rest of the video, but Botox can be used to shrink muscle mass. So another place that has become very popular to do it is in the trapezius muscles up here. I think they were calling it Barbie-Tox for a while. Some people have big, bulky trapezius muscles. So to slim the shoulder line, Botox can be used there. I've seen it used in the calf muscle for people who have bigger, maybe more masculine calves and they want a more feminine calf. I mean, to each their own, right? But when you are using Botox to shrink a functional muscle, something that lifts your shoulders, helps with neck stability, helps you walk, you always have to think about what are the functional consequences or potential consequences of that. So I don't just do masseter Botox willy-nilly or trap tox or calf tox in anyone. They need to have previously been assessed by someone in physical therapy, in physical medicine and rehabilitation, orthopedist, someone else who has deemed that like this is a problem and Botox would help functionally fix it. But I don't often just do it for the aesthetic purposes because I think it can have functional consequences that might not be foreseen. Moving down the face, we're kind of at jawline and neck here. So next thing I'm going to talk about is a Nefertiti neck lift. That is the name of the procedure, and it is to help the neck look longer and slimmer and help define the jawline. One of the major visual cues that we have that someone is aging is blunting of the jawline. So you can start to get jowly or heaviness in the lower face, or you can just lose that demarcation between the jaw and the neck. And a lot of people want to regain some of that back. This is another one where I had to let my Botox wear off a little bit to show you. But there is a muscle called the platysma, which is a big sheet-like muscle that kind of extends from here all the way up your neck and grabs onto your lower face and chronically pulls down on your lower face a little bit. So you can inject Botox along the jawline where the platysma muscle inserts, as well as down the platysmal bands, and I'll show you them because mine aren't injected right now. You see some of those? Down these bands here to release the platysma muscle. That allows it to fall back away from the jawline, which helps define the jawline, release the downward platysmal pull to allow the jawline to float upward and help with the jowl a little bit, as well as make the neck look a little bit more feminine and less stringy. So another thing that happens as we get older, especially when we talk, is you can start to see the bands in our neck more prominently, and a lot of people don't really like that. So you can do Botox along the neck bands, along the jawline to help with that as well. All right, we've basically covered Botox aesthetically for the face and for the neck. The last note I will make is about using Botox for improving texture and tone of the skin. So you can use micro Botox, which is typically very dilute, tiny superficial drops of Botox to improve skin texture on the chest, on the neck. You can do it on the face to help shrink pores and even help with things like rosacea. There's more research being done into that to get the exact correct dilutions and dosing, but I think that's another place that Botox will continue to go, is thinking about not just using it deep to help with muscle contraction, but also more superficially to see how that helps with the skin. And I think with that, we are going to end this Botox cosmetic primer. I hope you found it helpful. I'm very curious if you've had Botox before, if you learned about any areas that you didn't know about, or now have something that you want to try. Definitely let me know in the comments. As always, thank you so much for being here. Don't forget to like and subscribe, and I will see you next time.